Hello, viewers. From BirthRight by Rainbow, typically we are here to address points that are not raised in consultation rooms. Hope you find them very useful. I am Dr. Ratna of BirthRight Hyderabad, and I have with me today Dr. Surendra, who is from Androcare, a very senior urologist and an andrologist. And his main USP is that he makes the patient very, very comfortable. And let's discuss a few points which I hope will be useful for all of you. Good afternoon, Dr. Surendra.
Good afternoon.
So, a few points on why male infertility is now such an issue these days.
Because in olden days, madam, when you see before 15 or 20 years actually, so our elders used to have their marriage at the age of usually 23 below 25. But now the male age, if you see, reason may be different. Maybe they focus on their career or their some dependence on them, like their sister's marriage, something is there. But most of the male people, they are having their marriage at the age of above 30 years. So that's very, very most common pattern we are seeing, first one. Second thing, this also very important, is the lifestyle activity. So in the sense, you see, everybody evening, if they have some few minutes of time for rest, everybody going and chatting and taking tea. That's good, but along with the tea, they are taking some spicy food and cholesterol high content food, what we call it junk food. So this what it makes is slowly that hormonal imbalance is there, so that testosterone will be impacted, that affecting the male infertility in these days most common.
So, the simple tea and samosa is also causing a problem.
Absolutely no, madam. Simple tea is okay.
Okay.
You are telling samosa.
Yes.
So which oil they are using? Number one. Number two, what is the content in that? Means polyunsaturated fatty acids.
Agglomerated oils.
For oils, most important thing. And along with that, along with the tea and samosa, they are having their smoke. So nicotine is one component which is a vasoconstrictor, again decreasing the blood flow to the testes.
Yes.
That makes again the spermatogenesis process a little bit low, that making much more the male infertility issues actually. And third thing, because of their busy schedule, most of the men, they are not focusing on exercise. Everybody, what they are telling, my boss comes at 8 o'clock, I should be there by 7:30. So I should have to wake up just at 7 and preparing, and they are not focusing on exercise. Every time it's a stasis process. So again, that is also making very difficulty. So these are
So, they are sitting most of the time.
most of the time. Even not only the software people, even doctors, you see.
Yes.
So most of them physicians are sitting and doing. So this is the
And also, the work culture has shifted. They have night shifts, they have deadlines, they are under more stress because the competition overall has increased.
so stress is the another component, either in the family or their work. Anything. These are the simple things which we can manage. Early age marriages, number two, lifestyle changes. All this usually makes us to get good sperm, so natural pregnancy will come. Otherwise, male infertility, nowadays it is nearly 50%. Now it may increase more than the female infertility.
That is very scary. And in the urban cities, the Hyderabad and all this pub culture, every weekend going to the pubs, and alcohol is also not good for the sperm.
Alcohol in limits,
Yes.
I use it to say. So in limits, social alcoholism always good. But just I told you, if you are taking tea or something, you don't stop with tea. So like this here also, you are taking
To a junk food, yeah.
smoking is there along with the junk food. What the bearer is bringing, you don't know, because everywhere it's a la carte is not there. So you will eat whatever it comes. Yes, come on, you will eat and eat. That makes disturbance. That's also one thing in the urban areas, madam, more than when compared to the rural areas.
So, majorly, the lifestyle is the one that is contributing to
Absolutely.
to male infertility.
Male infertility issue.
And a few of these are also contributing to erectile dysfunction, which is a very vexing problem for the urban male.
So it's very important issue arises, madam. Actually, men says, yes, my analysis is very good, everything is fine, but I am not getting. If you ask them, if you talk with them for a few minutes, slowly, they will first ask me, sir, if you permit me, my wife will be outside of my room. Then I will talk. Then slowly they will tell, sir, hardly per month I use it to have my intercourse or sex for only 2 to 3 days. Ovulation time is at least for 10 to 14 days. If you are meeting her with her partner, only it's a 2 to 3 times. How it will come? If I ask and go, he will tell, sir, there is erection issues for me.
Right.
Again, the problem is whatever I told that one. Along with that, there may be a vascular issue in him, or there may be a hormonal issue with his. And now we'll discuss the stress factors.
Sleep, yes.
Sleep patterns, obviously.
And also screen time. Throughout the day, they are with the computers, and in the evening, for entertainment, they want to watch Netflix or some other YouTube videos, and they're again on the screen for entertainment. So the screen time is also impacting the quality time that they spend with their partners.
Immediately what happens is whenever being their movies or something, slowly they will go to use to see the porn. That's also impacting the regular life. That is the important thing. Why? Because, sir, I want to have relaxation. She is also working. She's not there in home. So I used to have to see a little bit porn for 5 to 10 minutes. That will become habitual. Then they will masturbate themselves. So slowly the interest towards the partner will decrease. That makes erection issues. Again, that impacts on the male fertility.
So this erectile dysfunction, a very sensitive topic to bring up for any male. But if doctors like you make them comfortable, I think more of them will open up and they'll take meaningful help from you.
True, madam. So whatever problem is there, you can discuss with your parents, at least with your close friends. But the topic of sex comes, nobody, exclusive in India, what happens? They will take it as a taboo. So what the other person will feel, oh, if my sexual issues, if I tell to any other persons, maybe
It's an ego
so
problem.
inferiority complex, ego problem, and males always they feel that they are superior more than females. So these are the problems. So usually we come across.
That's right. So one thing which I want to ask you to educate our viewers is how some commonly used medication can lead to both erectile dysfunction and infertility issues. So this story was circulating how one young man before the wedding went for a hair transplant and a hair clinic, and they gave him finasteride. So we all know that finasteride is an anti-androgen, and that poor man had low sperm count and erectile dysfunction. So please highlight the factors of how some commonly used medications can
This
impact.
is the most common, right? Why? Because before marriage, what men feel is women want a good hairy person. So my hair is very low because that means androgenic alopecia is there. But he went to a dermatologist or some cosmetologist. They use it to put 1 mg minimum finasteride. What the dermatology or a cosmetology prospect is to increase the testosterone, which is correct in their prospect. But what a man required for his fertility is the active form of testosterone. That's dihydrotestosterone. So testosterone should be converted into dihydrotestosterone by specific enzyme, which is inhibited by this finasteride.
Right.
So he had good testosterone, which is not useful for his fertility issue. So it's a exogenous testosterone, or it will be like exogenous. So that will impact the brain, other hormones to stimulate the testes to produce the testosterone. If there is no intratesticular testosterone, slowly the spermatogenesis will be affected, and whatever good testosterone we require, that will be low, which is very useful for the erection. So these people have both fertility issues along with the erectile dysfunction issues.
That's good. The other thing was for bodybuilding, the fellow in the gym is prescribing testosterone injections. Please highlight the.
So same thing. So he used it to show his body.
Yes.
Immediately
For six packs and yeah.
at least that one, and for at least our partner, his partner, he wants to show that one. So along with the hair transplant, what he will do regularly, he will do gym. At least he will spend more than his work. He will spend in the gyms at nights. What this guy will say, no, your body is good enough, but if you boost with some hormones like testosterone, it will be improved. In my practice, whoever practicing gym, even the gym trainers also, they're prescribing this one. If I examine the testis clinically, very small testis, less than 25% of normal size. Because exogenously, outside you are giving the testosterone, the brain normally what it thinks, already good testosterone is there. Why I have to produce test? Why I have to give signal to the testis to produce testosterone? So intratesticular testosterone will come down. So slowly testes will get atrophied, and they have only very small peanut size shaped testes also.
But this is reversible.
At least 6 months minimum, but 1 year is good. If you stop, then if you go to a good andrologist nearby you, they will check all the history. Then they will prescribe another medication and other medications, injection forms to improve that intratesticular testosterone. That will be very useful. This is misleading by so why? Because if you see, madam, outside so many gyms are there, branded gyms are there. Everybody take it as a fashion to show their body and everything. So movies also turning this in that form, only to show the body zero. They are doing one movie.
That's right.
So usually audience will tempted for that. They will go, oh, he's going this gym, I'll also go to that gym, I'll use that medication or some foods, and I will improve my body. This is the problem usually.
So the message sir is giving is when you are taking medicines which are not prescribed by qualified doctors, please verify if they have any such major side effects and will impact you in a negative way. Right. So now the other thing is about the normal semen analysis. So we get quite a few couples who get the report to their hand. They Google the report either on Google or Gemini or now Perplexity, and they get very scared with these reports like teratospermia, oligospermia, and before they come to us itself, they have a lot of anxiety, a lot of stress. So, sir, please share what you want the couples to do once they get the semen analysis in their hand. Yeah.
Usually, in semen assessment, we use it to see 3 components mainly. One is the sperm count. Second thing is the motility of the sperm. Third one is the morphology, which you just called regarding low morphology. Usually, they will give the impression of teratogenic. Even if you see number of papers also, so what they will tell is teratogenic is one component. You little bit bothering is a very less in that.
That's right. It doesn't matter much.
Yeah.
Even if it is there.
Normally, what is the percentage is the 4%. This is the latest WHO guidelines. So immediately, if you see, even if you have 2%, 98% abnormal they have given. Immediately they will see and they will search Google. It will give 90% abnormal. So very difficult to get good sperm and you won't get pregnancy. Or even IVF also very difficult for you. In that way, they will think.
That's right.
So the best thing is, first if you see, either you consult a good fertility specialist, either male or female. It's not bothered because they know the knowledge. They will tell teratogenic morphology is not good. 2 is also okay. Why you are bothering? We will give confidence to them. That will be very useful. More than that morphology, that teratogenic, you can check the functional. What is the functional normality, functional abnormality of the sperm? If that is good, absolutely you will get pregnancy. I don't tell in every case it will be natural. The other ways are there. So more than it may be a UAE or IVF, but finally we will give a good baby to you.
That's right. So we should not try to interpret reports using Google artificial intelligence and get upset by it. So here I just want to say, sir, we started using Kruger's strict criteria. With that, the reports have become a little scary to the layperson, but we can interpret them properly for you and reassure you that, fertile sperm is there, even if it comes as a teratospermia.
Nothing to worry.
Nothing
so
to worry.
They should have to go to a good andrologist or fertility female specialist. First, they will give assurance. In fertility, the main component is the confidence.
That's right.
If you had good usually what happens, 2-3 months over, they are planning their ovulation period, they are having good intercourse, everything. Suddenly, after 4th month, also pregnancy does not come.
Starts rising.
Slowly stress starts. That will lead to first erectile dysfunction.
That's right.
At the time of ovulation, her complaint is, madam, 3 months is good, madam. Now there is no erection. First, just leave the fertility. First, give good erections for him by giving some tablets.
And most of it is what we call psychogenic impotence. At the time of ovulation, the poor gentleman is stressed so much that he cannot perform really crucial. Absolutely.
You just leave them.
That's right.
Go for a simple party, everything, just picnic. They will have good sexual life.
So, sir, here what we do with the couples is we encourage them to come for a preconceptional counseling where we explain this fertility rate or the conception rate. If 100 couples are trying for pregnancy, most of them think that all of them will conceive in the first month itself. But it's the actual fact that only 15 to 20% will conceive in 1 month. If you follow 100 couples for the next 6 months, 60% will conceive in that 6 months. For a total 80 to 90% to conceive, even without any problems, it may take 1 year.
1 year or
There will be only a 10% left who will actually fall into the diagnosis of infertility. So, this is another takeaway message, that is, have realistic expectations about when we are going to conceive. So, consult the doctor, have a preconceptional counseling. So, if such a couple comes to you, for the lady, we do the glucose, the HbA1c, the thyroid, the CBP. What would you do for the gentleman, and what advice would you give them if they come for a preconceptional?
usually first we'll advise the semen analysis. If it is any small abnormalities are there, otherwise they will tell, sir, if you done first analysis, then next test, oh, sir, simple test, whatever is there. So basic 3 tests we'll do. One is the simple semen analysis. Second one, hormonal weight test. Some testosterone, FSH, more than sufficient. So because these 2 hormones, they will give the good prognosis, what is the next steps we can take. And any disparities there, we'll put some good medication. Third thing, after clinical examination, depending upon the situation, we'll advise to take a simple ultrasound scan of the scrotum, because there may be a small masses are there, varicocele is there, number 3, any infective component is there. Then by seeing clinically, then we'll advise simple, it's a non-invasive test, simple ultrasound like abdomen. So ultrasound scrotum, these 3 usually.
But if the semen analysis is just borderline,
usually no need.
No need.
Usually no need.
And
Just give confidence to them.
right.
It takes time. Don't if you go to a shop, you can buy. If it is not available, you go to a next step. If you go to a mall, same products in the shop, you will shop. It's not like that. Just wait. You should have some patience. 100% things will be good.
But we are dealing with an impatient generation now, sir. They want everything on demand and on time. So the one more thing which I wanted to highlight, sir, if one semen analysis is slightly low, people get very upset. How would you reassure them, sir?
Immediately after 1 week, just be relaxed, repeat the analysis.
1 week.
Why? Because first time, so the area, in some diagnostic center, they will give washroom.
That's right.
So regularly, if you take your clinic or my clinic, we had some special single room.
That's
So everything is good. So he is very free to be the sample. So there may be some simple collection issues are there. The environment also impacted. So after 1 week or 10 days, repeat the sample. 80 to 85% people
Maybe
then
normal.
compared to the first one, second one will be a real improvement.
So this is a very important message, sir, has given. If there is one altered or low sperm count, please do not panic. Just wait for some time. Go to a better lab, alternative lab, and give a second sample. We never treat one abnormal value. We always reconfirm it with another.
Yes.
Now, sir, when we counsel for the first level of treatments like IUI, we give a success rate of 15 to 20%. So they keep asking why the rates are so low. So what would you tell them, sir?
Aspect I can actually, you are the correct person, madam. But what I can tell from my perspective, IUI nothing but it's a simple bypass of 6. So usually at the time of intercourse, what the ejaculatory sperm will do, here we are collecting, washing the sperm, we are giving to the field. That's it. So that's why that is the success of only 15 to 20.
So I call it, we are boosting their fertility. If we combine it with ovulation induction, instead of 1 egg, we are trying for 2 eggs, and the sperm are being centrifuged. So
Your sperm will be a little bit good quality sperm you can give.
right.
So that is the reason why it is only
Yeah, so it is just a magnification of the natural process. So it has only a 15 to 20% success rate. But what we try to tell them, sir, is a cumulative success rate. So if we do it for 3 to 4 times, we can go up to 50 to 60.
the successful.
Right. But what I really tell the couples is, between one and IUI to the other, we give lot of importance to obesity corrections, the organic food, the what you have mentioned, the sleep, the lifestyle. So unless you are healthy, you won't get a healthy sperm, and unless you are healthy, you won't get a healthy egg. So you can't abuse the body and expect healthy sperms and healthy eggs. So between one IUI and the other, we tell them to exercise, eat organic food, because now there's a lot of use of pesticides, use a lot of chemicals like body sprays, and we are exposed to chemicals which have these phthalates, and they mimic the hormones. So as we know, estrogens are very bad for the male. So in all these exposure to the pesticides, phthalates, that is the food heated in the plastic containers give rise to phthalates, the body sprays, and as now without knowing you may be using all these powerful medications for hair loss, for bodybuilding. All of these can impact the sperm. So have a good honest discussion with your specialist, see what can be remedied before we can go for higher treatments like IVF. As we conclude, Dr. Surinder, I want a message to all the gentlemen over there, how to, in simple ways, to have a healthy sperm and not have a recourse to medicines and IUIs and IVFs to become fathers. In a few words, a simple message.
So first what I can tell you, to get good sperm, before I'll tell that, you should be open to your wife first in any aspect. Your life will be very cool, stressless. So have good intercourse issues. Anything is there, just go to a good andrologist. So then sexual life will be good. Automatically your fertility issues will be cleared. But specifically if you ask me, lead a good lifestyle activity, means regular exercise. If there is no time for you, either it is a morning or evening, minimum is the 40 minutes. Simple walking, no need to go anything to pay them. Simple brisk walking for 40 minutes. Number 2, if you had a habit of smoking, at least for your first baby you will stop. Then after that, whatever you want, go ahead. And third thing, if you are taking an alcohol, so take not in binges, just take little bit like socially, take alcohol, and take junk food little bit. If there is a function, so no one is there to stop you, so stop the junk food. If you change your lifestyle, most of the simple things, whatever the sperm count or sperm morphology, motility, as the time goes on, 2 to 3 months time if you give, because chondrogenesis cycle is 3 months, so in 3 to 4 months at least you will get, when compared to the previous report of your semen analysis, little bit improvement is there. No need to go either to an andrologist or any further treatment. But if things are not in favor of you, then don't take by seeing or hearing the artificial intelligence or ChatGPTs. I don't tell they are not correct. Absolutely they are correct, but
Don't depend on this.
yes, this is not a shopping batch. This is your health, your generation you should have to produce. So whatever you hear or you read, go to your andrologist or good fertility specialist, discuss with them. Whatever medication they will prescribe, use that medication. Excellent, your fertility life is there. That I can talk about.
And also one thing you said earlier, sir, it's not a taboo to have erectile dysfunction or fertility issue. Nowadays, unfortunately, they have become common. So don't get stressed to take help and go to a fertility specialist or an andrologist. One more thing, sir, I always tell the couples, you have a commitment to your unborn child. So before you're producing children, you should be a good father. You should be in good health to take care of yourself. Therefore, your weight, he should show somebody, show some other person and say, this is my father. And that father should be healthy, should be non-smoker, should not be overweight, should not be an alcoholic. In other words, the child should be proud of his father. So this is the commitment you have to your unborn child. So it's before you're producing children, you have to look after yourself. I think that goes without saying, and people forget that somewhere along the way. So have a commitment to your unborn child and get your health in order, get your eating in order, and you have to set an example to your son or daughter as well. So you be a very good example.
True.
Right. So while wrapping up this podcast with Dr. Surinder, thank you, sir. You've shared some very practical tips and very good points. I'm sure the users will find it very helpful. And users, please do share it with other friends who might find this useful as well. So this is the first episode from BirthVibe by BirthRight. And please stay tuned for more such practical tips and interesting conversations. Thank you.
Thank you.